This is Appendix 1, beginning on page 199 for Body Systems. This appendix contains full color diagrams of body systems. For each system, the material presented is divided into 7 sections. Anatomy shows major organs and structures with labels and combining forms for each body part. The parts of the body are defined and explained in the mini dictionary. Terminology reviews combining forms in their meanings and gives examples of medical terminology using each combining form. Pathology explains terms related to common pathological conditions. Laboratory tests and diagnostic procedures presents common tests and procedures which can be cross-referenced for additional information in Appendix 4, Diagnostic Tests and Procedures. Treatment procedures explains therapies that treat abnormal conditions in each system. Abbreviations list selected abbreviations for easy reference. Matching exercises review the terminology to reinforce your understanding. Use this appendix both as a study guide for classroom work and as a reference for your work in the medical field. So our body systems that we will cover in this appendix are the cardiovascular system, digestive system, endocrine system, female reproductive system, lymphatic system, male reproductive system, musculoskeletal system, nervous system, respiratory system, skin and sense organs, and the urinary system. So we first begin with the cardiovascular system. If you take a look on page 200, this is the anatomy of the cardiovascular system. Red vessels contain blood that is rich in oxygen. Blue vessels contain blood that is oxygen poor. Arrows show the path of blood flow from the tissue capillaries through venules and veins toward the heart, to the lung capillaries, back to the heart, out of the aorta, to the arteries and arterioles, and then back to the tissue capillaries. Our terminology. Meanings for terminology are found in the mini dictionary beginning on page 353. So our combining form, we have angio. This means vessel. So angioplasty, surgical repair of a blood vessel. A tube or catheter is placed in a clogged artery, and a balloon at the end of the tube is inflated to flatten the clogged material against the wall of the artery. This enlarges the opening of the artery so that more blood can pass through, aka balloon angioplasty. Then we have the combining form of aorto. This means the aorta. Our terminology, aortic stenosis. This is narrowing of the aorta. Next we have arterio, which means artery. Arteriosclerosis is hardening of the arteries. Then we have arteriolo. This means arteriole. Arteriolitis. This is inflammation of small arteries, also known as the arterioles. Then we have cardio, which means heart. Cardiomyopathy is disease of heart muscle. Pericardium is the membrane surrounding the heart. Next is corono, which also means heart. Coronary arteries, blood vessels that carry oxygen-rich blood from the aorta to the heart muscle. Phlebo means vein. Phlebotomy is incision of a vein. Veno is also vein. So intravenous is pertaining to within a vein. And then we have venulo, which means venule. Venulitis is inflammation of a small vein. Next is our pathology section. We have aneurysm. This is the local widening of an artery caused by weakness in the arterial wall or breakdown of the wall from atherosclerosis. Next, angina. This is chest pain caused by decreased blood flow to heart muscle, also called angino pectoris, where pecto means chest. Arrhythmia is abnormal heartbeat or rhythm. Fibrillation and flutter are examples. Atherosclerosis. This is hardening of arteries with a collection of cholesterol-like plaque. Congestive heart failure is the inability of the heart to pump its required amount of blood. Blood accumulates in the lungs, causing pulmonary edema. Hypertension. This is high blood pressure. Essential hypertension is high blood pressure with no apparent cause. In secondary hypertension, another illness, kidney disease, or an adrenal gland disorder is the cause of the high blood pressure. Myocardial infarction. This is a heart attack. An infarct is an area of dead or necrotic tissue. And then we have shock. This is a group of signs and symptoms: paleness of skin, weak and rapid pulse, shallow breathing, indicating poor oxygen supply to tissues and insufficient return of blood to the heart. Our next section is laboratory tests and diagnostic procedures. Angiography. This is recording via X-ray images of blood vessels after the injection of contrast into the bloodstream. Cardiac catheterization, introducing a catheter, which is a flexible tubular instrument, into coronary blood vessels to measure pressure and flow patterns of blood. Cardiac enzyme tests, measurements of enzymes released into the bloodstream after a heart attack, again also known as a myocardial infarction. Doppler ultrasound, measuring blood flow in vessels via sound waves. Echocardiography, images of the heart are produced using sound waves. Electrocardiography, recording electricity flowing through the heart. Holter monitoring, detection of abnormal heart rhythms or arrhythmias that involves having a patient wear a compact version of an electrocardiograph for 24 hours. Lipid tests, measurements of cholesterol and triglyceride levels in the blood. Lipoprotein tests, measurements of high-density lipoprotein, or HDL, and low-density lipoprotein, LDL, in the blood. MUGA scan, imaging the motion of the heart walls and muscles, and assessing the function of the heart via a multiple gated acquisition scan, which uses radioactive chemicals. Stress test, an electrocardiogram plus blood pressure and heart rate measurements shows the heart's response to physical exertion, also a treadmill test. Technetium TC99M sestamib scan, a radioactive pharmaceutical, sestamib tagged with technetium-99M, is injected intravenously to show perfusion or flow of blood in heart muscle. It is taken up in the area of a myocardial infarction, producing hotspots. In an ETMIB exercise tolerance test, an intravenous radioactive substance is given before the patient reaches maximal heart rate on a treadmill. And then we have the thallium-201 scan, A radioactive test that shows where injected thallium-201, which is a radioactive substance, localizes in heart muscle. Next, we have treatment procedures. Cardiac catheter ablation. Flexible tube is threaded through blood vessels into the heart to destroy or ablate abnormal tissue that causes arrhythmias. Cardioversion. Brief discharges of electricity passing across the chest to stop a cardiac arrhythmia, also called defibrillation. Coronary artery bypass grafting, also known as CABG. Vessels taken from the patient's legs or chest are connected to coronary arteries to make detours around blockages. Endarterectomy, surgical removal of the innermost lining of an artery to remove fatty deposits and clots. Heart transplantation, a donor heart is transferred to a recipient. Percutaneous coronary intervention, or PCI. A balloon-tipped catheter, a flexible tubular instrument, is threaded into a coronary artery to compress fatty deposits and open the artery. Stents, which are expandable slotted tubes, create wider openings that make the recurrence of blockages less likely. This is also called balloon angioplasty. Next is thrombolytic therapy. Drugs such as TPA, tissue plasminogen activator, and streptokinase are injected into a patient's bloodstream to dissolve clots that may cause a heart attack. And then Watchman procedure. A small parachute-shaped device, a Watchman device, is placed into the left atrium of the heart, the left atrial appendage. This reduces the risk of a stroke by lessening circulation of blood clots that may travel to the brain. Our next section is abbreviations. We have AAA. This is abdominal aortic aneurysm. ACS, acute coronary syndrome. Disease changes in coronary arteries leading to plaque or clot formation and heart attack or other heart problems. AED is automated external defibrillator, an electronic device that can diagnose and treat serious arrhythmias. AMI, acute myocardial infarction or a heart attack. BP is blood pressure. CABG, coronary artery bypass grafting, surgical placement of vessels, either vein or artery, to detour blocked coronary arteries. CAD is coronary artery disease. CCU is the coronary care unit. CHF, congestive heart failure, where the heart is unable to pump its required amount of blood. CPR is cardiopulmonary resuscitation. ECG or EKG, electrocardiography. Echo is echocardiography. HDL, high-density lipoprotein. HTN is hypertension or high blood pressure. ICD, implantable cardioverter defibrillator. LDL is low-density lipoprotein, a combination of fat and protein, high cholesterol content, and associated with formation of plaque in arteries. MI, again, is a myocardial infarction or heart attack. PCI, percutaneous coronary intervention, placement of a catheter and stent in a coronary artery to open the artery, also known as balloon angioplasty. And then lastly is T or TEE, transesophageal echocardiogram.